Do they have moderate disabilities? Do they require somebody to help them with feeding? We're also looking at some secondary outcomes of intracranial pressure, intracranial hypertension. We're looking at brain tissue oxygen, therapeutic intensity scores, and then just the safety of rolling this out outside of a phase 1 study. Oxygen toxicity is a big concern, especially when we're doing these high pressures, high durations of treatment for multiple treatments during that first 5 days. We know that oxygen toxicity can manifest itself as seizures, and these patients are at increased risk of seizures. We also know that it can manifest itself as a lung injury. And so we have some very strict criteria by which we control which patients are going to be diving. We also are doing this in patients who are multi-system trauma patients. So many of them have lung injuries unrelated to hyperbaric oxygen treatment. And so because of that increased risk, there are criteria where we would stop treatments. This is a list of some of the centers that are enrolling patients for this trial. This trial has just gotten started in the last few months, so we're still in the very early stages of enrollment. So in conclusion, wear your helmet, wear your seat belts, all right? Probably the most effective way of improving outcomes from traumatic brain injury is to prevent the primary injury. But as we start to talk about ways that we can attenuate that secondary injury, hyperbaric oxygen therapy is a treatment that, honestly, we don't know if this is going to be effective or not, but this is the way to figure it out. I think that with a high degree of confidence at the end of the trial, we'll be able to say either that this is a treatment that makes good physiologic sense but doesn't actually change clinical outcomes, or that it's promising and needs to go on to a phase 3 trial. And that's the reason that this was designed in the way that it was. And the HOBIT trial is currently underway at the university. I'd be happy to take any questions that you have, and thank you for your time today.
Thank you. Do you have any questions for Dr. Mohr or Mike?
I'm curious on the traumatic brain injury. Are you talking about people who have been in just accidents? Are you talking about people who've had strokes, aneurysms that have blown?
Great question. Great question. For this trial, we're only enrolling patients after physical trauma. So car crashes, motorcycle crashes, all blunt trauma. Mm-hmm. Great question. Yeah?
Any studies being done on PTSD post-injury?
That's a great question. The question was, are there any studies that are being done in PTSD, post-traumatic stress disorder? The VA has done a little bit of work, although I don't know of any big phase 3 trials on that. Mike, are you aware of?
Like I mentioned earlier when I was speaking, the Department of Defense did their initial study about 4 years ago. I think it was Wolf and et al. And it was completely blown apart by the rest of the hyperbaric industry as they identified that they didn't gather the correct information, use the correct study methods, et cetera. So recently the DoD redid the study, and their conclusions found that people that have suffered from PTSD that have been exposed to like percussive injuries, et cetera, only receive about 6 months worth of alleviance, if you will, from their conditions, and then they're right back to baseline within 6 months. That observation does not go with a lot of the subjective information that's been shared by other people that have gotten the information. So I think it's open maybe up for another phase in identifying that. I truly think it does have benefits to that disorder, as long as it's PTSD associated with exposure to percussive injuries, et cetera, door breaching devices, IEDs, whatever.
Great question. Any other questions?
These studies that are being done, does that help like the insurance companies, like they look at that and say it's easier for them to pay?
Yeah, I mean, all of these things, the question is whether it's beneficial, right? And I think that some of the data in hyperbarics have not been really large, well-done, phase 3 randomized trials. And that's the reason why for traumatic brain injury, we don't know yet whether this is beneficial, but doing studies to know whether this is beneficial will clearly drive the utilization of this therapy in the future. If this doesn't work, we don't actually want people to be put in hyperbaric chambers because there's some risk to putting traumatically brain injured, critically ill patients with multi-system trauma on ventilators in hyperbaric chambers. But if this is beneficial, and if this can help people walk home who previously wouldn't have been able to, that's what we want to do. Mm-hmm. Great question.
Any other questions?
All right, thank you.
Thank you.